All right. Thank you, Sally-Ann. Leckenow Hospital is home to the doctor who is recognized as the world leader in robotic heart bypass surgery.
That's a big deal. And Jen Frederick this morning has convinced him to let her in the operating room as he performs one of those surgeries. It's a big deal. She's live at Leckenow Hospital now. All right, Jen Frederick, set this up for us.
Okay, so here's the thing. People are wondering, how did I just happen to find the world leader in this surgery? And this is how I found the man. This is Mary Lou Sutter, and you guys know her. This is Pippi Longstocking. We use her for fitness segments, and you were telling us about how great your fabulous cardiac surgeon husband is, yes?
Of course.
Okay, so this morning you gave me a bit of a test drive on your equipment, and what we're going to see in the 9 o'clock hour is you performing a bypass with the use of this amazing robotic machine.
We're going to show you 21st century heart surgery using a robot. Now, this isn't done in most places, in 99% of the heart surgery hospitals in the world, but it's the cutting edge way to do heart surgery. And we can do through incisions this big versus this big with the broken bone.
And part of what you guys talk about here a great deal is having choices. Obviously, every surgery can't be done using this equipment. Sometimes you have to do it the old-fashioned way. You have to get in there. Yesterday, when we came for a little survey, I had the opportunity to see you with your hands inside someone's heart, literally.
Yes.
It was pretty exciting. And there's a woman that's coming in. Her name is Carol. She's coming in right as we speak. And when we talk about this connection between working out and your practice, good morning to you.
Good morning. How are you?
This woman, Carol, was completely fit, learning how to work out, worked out with with a personal trainer, rather, that really put you through the ringer, and you ended up in his hands, correct?
That's correct, yes.
And so for that, you had to do a traditional heart surgery. And I want to show people how you saved her. And look at this. I may not have gone to medical school, doctor, but I have been shown this diagram a couple times. Basically, she was feeling a little bit of, in her chest, she was feeling kind of strained, and she thought it might have been because you had worked out and done a new routine, right?
Correct.
As it turned out, it was so much more.
But it wasn't just working out. It was weightlifting.
Okay.
And with weightlifting, when you bear down in what we say in the business, Valsalva, where you're bearing down and holding your breath, your blood pressure can triple. Her blood pressure tripled and broke the inner lining of the artery, and half the blood went into a cul-de-sac, and it filled up that it's so much that it narrowed the artery itself and the blood flow to her heart. So her chest pain, in addition to the muscle strain, was due to her heart.
Which brings us back to Mary Lou. And you talk about, and I know there's going to be a lot of people out there saying, there's another reason why I shouldn't work out, that that she fell into such a terrible situation, and she's doing well, and she looks fabulous.
She's doing great.
But it's also one of the reasons why when we talk about your fitness professional, that it should be someone who has their wits about them.
Absolutely. And something as simple as breathing through exertion sounds like a no-brainer. But so many people grit and grind when they exert heavily, even when they pick up a box. It's been known to happen when people cough violently. Wow. It's really scary stuff. And this beautiful woman, who's still in the prime of her life and just barely, 35? And it happened to her.
Okay.
And so it's really something you have to pay attention to.
All right, so this is what people can look forward to. In the 8 o'clock hour, we are going to show them exactly what I did. I got in there, did a little test drive. They saw a little bit of the video. You'll see more of that. That's when you are beginning the surgery that you are actually performing today. That's where you will be while I'm doing the demonstration.
Yes. One of the options for heart surgery is to use the robot.
Okay.
Now, that's an option for bypass surgery more than half the time.
Okay.
But you're going to see that now.
And then at 9 o'clock, Chanel and John, I'm going to be in there with the scrubs, with the fancy headgear, and we're going to be talking to him as he actually performs this surgery. So it's going to be an amazing morning, and I thank all of you guys for being here. And did I mention that I was in there yesterday when he had his
that was
hand
interesting. And even the part, that's interesting. And even the part about the lifting the weights and the breathing, I always thought they said to breathe just so you didn't pass out. I didn't realize that there was a physical reaction inside with your blood pressure.
And that's how this all comes together.
Wow.
Yeah, that's why Mary Lou is so passionate about making sure that people do it correctly. And we started talking about it. I said, well, how bad could it be? And she said, oh, I can tell you how bad it can be. You could talk to my husband a little bit about that. So we have some amazing statistics that are going to scare you. Eat your broccoli, work out, but do it properly.
No, it makes you want to eat better. All right,
fascinating stuff. Thank you, Jen.
Okay.
We now know